Hi guys, welcome to week 2. This week we'll be covering pages 853 in your textbook to pages 857. We'll be talking a little bit about how drugs affect the body and how some of the factors of the human body can affect drugs. Due by the end of this week is the syllabus and Moodle quiz that lives in week 1. You have until the end of week 2 to do that, as well as the week 2 assignment and the week 2 forum. Don't forget to make it 250 words for your original post and 100 words for each of your 2 replies to your classmates. So this week we're going to discuss pharmacodynamics. To start off, pharmacodynamics is the study of the effects of drugs on living organisms. It's what drugs do to our body. So drugs can act on receptors, and they bind to different protein molecules or chemical groups, and those are the receptors. And when they bind to those receptors, they cause a change. It could be a change in the permeability of a cell. It could be a channel that opens and allows potassium to come into a cell. Or it could be something that causes a messenger on the other side of the receptor to go tell something in the cell to turn on or turn off. So to bind correctly, the drug must have a chemical structure similar to that of a receptor. And sometimes when they're making drugs, if they know the structure of the chemical that normally binds to the receptor, they try to model the drug to look just like that. So an affinity is a measurement of how tightly the drug attaches or binds to a receptor. So the higher affinity, the more the drug is, if we go back and remind ourselves that this chemical structure must be similar to that of the receptor, affinity is the measurement of how tightly the drug attaches or binds, or how similar it is. So kind of like puzzle pieces fitting together. If a drug has low affinity, the puzzle pieces aren't going to match up well at all, and might not even think about binding together. If a drug has high affinity, the puzzle pieces match up really well, and can also, in addition to thinking about it as a puzzle, think about it as a lock and key. If the key fits in the lock, it's going to open up the channel, or the door, hopefully, in this case. Agonists are drugs that bind to receptors and affect cell response. This is a positive term, meaning a drug causes a response from the cell. An antagonist, meaning no response, is a drug that prevents cell response. So here we have a little picture of how that all works. So before the drug, the neurotransmitter usually fits into that site right there. Right around here, right? So it looks like it fits in pretty well. It's a good puzzle piece, good key in the lock fit. So we designed an agonist drug that sort of matches that same fit. Looks very much like the drug where it binds to the receptor. The agonist drug causes an increase in chemical activity. An antagonist drug doesn't look as much like the drug, but it might block the receptor. Sorry, my dog's a little keyed up tonight. An antagonist drug will prevent not only the action from happening, but won't let the neurotransmitter that normally affects that receptor bind either. So it's what we call a blocker. Dose response curves. These tell us basically the drug concentration is on the y-axis. The drug time, the time that the drug has been in the body, is on the x-axis. And it tells you, it tells you how effective a drug is at certain concentrations. So, drug manufacturers have to perform a lot of testing prior to the drug's distribution to determine the risk-to-benefit ratio. The manufacturer also has to determine the therapeutic index. So you see here where it says minimum effective concentration. This is the minimum amount of drug required in the body to be effective. So it looks like 20. And they don't have units, but let's just pretend it's 20 milligrams. Then there's a minimum toxic concentration, meaning that that's the minimum amount that takes to be toxic to the body. So what we have between the two of them, so between, let's say, 32 and 20, is a therapeutic window. Anything in between here is therapeutic. It's working, it's making the body do what we want it to do. Anything above is toxic, and anything below is ineffective. So testing prior to the drug's distribution, we want to determine risk-to-benefit ratio, the therapeutic index, and the drug ceiling. The drug ceiling is a maximum dose at which the drug will provide its greatest effect. An example of this would be some NSAIDs like ketorolac or ibuprofen have a maximum at which anything further provides no better effect, but it may become more toxic. So for ketorolac, that maximum is 10 milligrams. Anything above 10 milligrams isn't any more effective than 10 milligrams, but can certainly be more toxic. Let's see. Opioid drugs, such as morphine, do not have a ceiling effect and are used in patients that are terminally ill because we can use increasing doses without ever hitting that ceiling. Risk to benefit ratio. They'll talk about this a lot in practice. Do the risks or toxicities of the drug outweigh the benefit or vice versa? The therapeutic benefit of the drug. Let's talk a little bit about bioavailability. This refers to the extent to and the rate at which the drug enters the blood plasma and is made available at the site of an action. IV drugs have 100% bioavailability. The minute you put them into a blood vessel, they are available for use within the body. This isn't the same as when you put a drug in the stomach. It has to go through absorption. It has to make its way to the bloodstream. It takes longer. So IV drugs at time 0 are 100% bioavailable. So as you move down that list from solutions to suspensions to capsules to tablets and finally coated tablets, solutions are absorbed the quickest, followed by suspensions, then capsules, whereas tablets and coated tablets take a little longer to break up and be absorbed. So if you're looking for something super fast acting, but you can't give it IV, you have to give it by mouth, you think about giving a solution because that's going to be absorbed the quickest. So here we have a couple charts that show the amount of time it takes for a drug in oral form to reach its peak plasma effect versus a drug administered intravenously. So top one is a drug that was given by mouth, and drug concentration from time 0 starts to rise, and then it peaks, and it falls. Time to peak was about 1.6 hours. So we can say we would give the patient this drug, and maybe within a few minutes, let's say 10, it would start working, and they would feel better and better and better for about 1.6 hours, and then it would slowly wear off over the next 6 hours. So 7 hours, 7.5 hours total action. Here we have a drug that was given IV. Time 0 is where it peaks, and everything after that is sort of a decrease, right? And that's because at time 0, 100% of it's available, and it decreases over time. Drug actions. So drugs can be grouped by the type of action they produce in the body. Maybe it's a local action. The drug acts on an area of tissue in which is it administered. Maybe it's a remote action. The drug has an effect in different locations in the body than where it was administered. So an example of a local action before we move too much further on would be topical medication, something that you rub on. Maybe you rubbed on pain relieving medication because your knee is sore after playing basketball. For remote actions, maybe you, maybe you did a nerve block. You're having pain in your hand, but you have to block the nerve that runs to your brainstem in order to block the pain. Systemic action is where the drug is absorbed into the bloodstream and carried to other parts of the body. This can be a number of different drugs. Most of the drugs I can think of are systemic action drugs, such as antibiotics, when we have maybe a body-wide systemic infection and we need to treat it in very, very sick patients. So drug effects, and this is an important question on your homework that a lot of people tend to get wrong, so let's pay attention very closely right here because I'm going to tell you exactly what examples of each of these are. Therapeutic effect is the desired effect that a drug has in the body. Actually, I think it's the next slide, possibly. Maybe it's the next homework. Maybe I'm already ahead of myself. So drug effects, you can sort of ignore me there then. Therapeutic effect is a desired effect that the drug has in the body. A side effect is a secondary effect in addition to the therapeutic effect. Some side effects end up becoming secondary uses for the drug. However, if they are unpleasant or harmful, they are considered adverse effects. And this can be anything from a headache to a rash, all the way up to bad outcomes like increased illness or death. So keep in mind, side effects can end up being secondary uses. whereas adverse effects are usually unpleasant and harmful and would never be useful. Drug interactions. This occurs when one drug diminishes or increases the effect of another drug. And the way it does that is it interferes with its metabolism, which we'll talk about probably, I think, next time around. Come here, Fana. Sorry, guys. I have a 1-year-old dog who needs a ton of attention here. So drug interactions. So if a drug prevents the metabolism of another drug, that means drug 2 is sticking around for longer. There's more of it for longer periods of time. If a drug induces or increases the metabolism of drug 2, that means that drug is going to go away quicker, drug 2. So a drug allergy, and you have to be careful with allergies because not all allergies that patients report are actual allergies. So a drug allergy isn't when the body forms antibodies against specific chemicals in a drug. These can be anywhere from not so severe, such as a local reaction like hives or a rash, or itching, all the way up to systemic reactions and anaphylaxis. But keep in mind, when a patient tells you that they have nausea or vomiting, that's more of an adverse effect than an allergic reaction. However, you may want to keep note of it because you don't want to make your patient feel bad and have nausea or vomiting. So back to allergic reactions. Anaphylaxis is the most serious of allergic reactions, and this is an advanced systemic reaction which can result in swelling of the throat and tongue and the inability to breathe. It's a life-threatening reaction that requires immediate action, and patients should take note if they are allergic to something that causes anaphylaxis, such as peanuts or tree nuts or shellfish. So last but not least, we're going to talk about pharmacokinetics and some different stuff that affects how drugs act in the body. Pharmacokinetics is a term that describes how the body reacts to the drug, which depends on specific variables of the individual taking the drug, the form of the drug, the chemical composition of the drug, and the route or mode of administration. So let's talk about variables affecting drugs' blood plasma level. Sorry, they split that up a little funny there. First is absorption. This is how the drug gets into the body. So remember, if it's IV, it's already absorbed. But if it's in the stomach, it has to be absorbed through the stomach lining, body tissues, body fluids, and make its way into the blood vessels. If it's, let's say it's topical medication, it has to be absorbed across the skin. Next is distribution. This is the process by which the drug is transported from the blood to the intended site of action. Third is biotransformation. This is the process in which the drug is chemically altered and undergoes changes, usually by the liver, in order to be utilized as intended by the body. And last is elimination, usually takes place in the kidneys, and this is how we get the drug out of our body. This can also occur through the gastrointestinal tract, through breathing off of the drug, through the skin, the mucous membranes, but most of the time it's probably going to occur through the kidney. Factors that affect drug actions are listed in Table 30-2. I'm not going to go through them all. I want you to read through that and realize that there's a lot of different individual factors between each of us that can affect, stop, now, thank you, that can affect how a drug will act in our body. This can range from how heavy we are, how light we are, how old we are, and even if we're male or female, and amazingly, sometimes even if we are Asian or African American. So read through that. I know the race isn't mentioned there, but it is a factor as well. Let's see, anything else that's not mentioned there? Disease, renal liver disease really comes into play a lot when we talk about how drugs act or how we might dose a drug in the body. That covers week 2. Week 2 is kind of another short little unit, but has a lot of jam-packed terms in here that we really need to know and really need to understand in order to know how drugs work in the body. If you guys have any questions, email me as always, and if not, don't forget to complete your assignments and your form by Sunday at midnight, and I hope you have a great week too.